Last Tuesday, I was sitting in my garden with my 7-year-old great-granddaughter, Emily. She was helping me weed the flower beds when she suddenly looked up at me with those innocent blue eyes and said, "Grandpa, why do you always say you're fine?" When Mom asks, "But then I hear you crying in the bathroom because your tummy hurts." I was stunned into silence. Children have that gift, don't they? That ability to cut through all our pretenses with just a simple observation. For months, I'd been ignoring that dull pain that wrapped around from my back to my abdomen. "It's just age," I told myself. "What do you expect at 91? I'd been losing weight too, but I actually thought that was a good thing. My pants were fitting better. But little Emily saw what I was hiding from everyone else, even myself. That conversation saved my life. Because 2 days later, I was diagnosed with early-stage pancreatic cancer. And today, 3 years later, I'm still here to tell you about it. I'm Dr. Harold Silverman. I've practiced medicine for over 65 years, and at 94, I still volunteer at our local community clinic twice a week. I've seen thousands of patients come through my doors, watched medicine transform before my eyes, held the hands of the dying, and celebrated with those who conquered their illnesses. But nothing prepared me for becoming a patient myself. As a doctor who became a cancer patient, I have a unique perspective. I understand both the science and the fear that comes with something like pancreatic cancer. And what I've learned is that knowledge truly is power, especially with a disease that moves as quickly and silently as this one. Let me be direct with you. Pancreatic cancer is often called the silent killer for good reason. By the time most people notice symptoms, the cancer has often already spread. The 5-year survival rate is just 11%. Those are frightening numbers, I know. But here's what gives me hope. When caught early, that survival rate can increase to 42%. That's why recognizing the earliest warning signs is absolutely critical. I remember Margaret, a 78-year-old patient of mine. For months, she'd been telling her family doctor about her indigestion, her lack of appetite. "It's just old age," they told her. "Try some antacids." By the time she came to me, the cancer had spread to her liver. "If only someone had listened," she said to me, tears in her eyes. "If only I had pushed harder for answers." Or Thomas, who was 82 and attributed his yellowing skin to just getting older. He thought the itching was dry skin from winter weather. By the time he mentioned it to his daughter, a nurse, it was too late. These stories break my heart because they didn't have to end this way. And your story doesn't have to either. There's something I need to tell you, something many doctors won't explain clearly. Your body isn't failing you. It's actually trying desperately to communicate with you. Those vague symptoms you've been dismissing, they're urgent messages. And the tragedy is that most people, and even some doctors, misinterpret these signals until it's too late. You see, the pancreas is tucked away deep in your abdomen, behind your stomach. It quietly goes about its business, producing digestive enzymes and hormones like insulin. When cancer develops in this hidden organ, it doesn't create obvious symptoms right away. Instead, it sends out subtle distress signals that can easily be mistaken for dozens of less serious conditions. This isn't your fault. How could you know? In medical school, we spent just a few hours on pancreatic cancer symptoms. Even many doctors miss the early signs. And as we age, we're taught to expect discomfort, to not complain about every little pain. We come from generations that were taught to endure, not to speak up. But today I want to change that. I want to give you the information I wish every one of my patients had had sooner. Because contrary to what you might believe, pancreatic cancer doesn't just strike without warning. There are signs, 6 critical symptoms that, if caught early enough, could save your life. Now, before I share these symptoms with you, I want you to know something important. Having one or even several of these symptoms doesn't mean you definitely have pancreatic cancer. Many conditions can cause similar signs, but what I'm giving you is the power of awareness, the ability to advocate for yourself with your doctor, to ask the right questions and push for the right tests if needed. In just a moment, I'll walk you through each of these 6 critical warning signs in detail. I'll explain exactly what to look for, why they happen, and most importantly, what to do if you notice them. I'll share with you the exact words to say to your doctor to ensure you're taken seriously. And I'll tell you about the simple screening tests that could detect this disease months or even years earlier than it might otherwise be found. This information is straightforward, it costs nothing to know, and it could add years to your life. I've seen it happen with my own patients who caught this disease early enough to treat it effectively. Now let's talk about those 6 critical symptoms that you absolutely must not ignore. The first symptom is unexplained weight loss. Many of us would be delighted to lose a few pounds without trying. That's why this symptom is so dangerously deceptive. But when your body loses weight without you changing your diet or increasing exercise, it's telling you something is wrong. What's actually happening is that the cancer cells are consuming your body's energy. Additionally, if the tumor is pressing on your digestive organs, you may not be able to process food properly. If you've lost 10 pounds or more over a period of 6 months without trying, this is what doctors call a red flag symptom. Let me tell you about my patient Robert, who was 79. He was actually pleased when his pants started feeling looser. At Tolki, my age losing weight isn't easy, he told me during a routine checkup. But he'd lost 15 pounds in 3 months without changing anything. We ran tests immediately and caught his pancreatic cancer at stage 2. 5 years later, after surgery and treatment, Robert is still attending his grandchildren's baseball games. The correct approach, if you notice this symptom, is to keep a weight diary for 2 weeks. Write down your weight each morning. If you've lost more than 5% of your body weight in under 6 months without trying, don't wait. Call your doctor and specifically ask, could this weight loss be related to my pancreas? That specific question can trigger the right tests. The case. Second critical symptom is a particular type of abdominal and back pain. This isn't your ordinary backache or stomach upset. This is a dull pain that begins in the upper abdomen and radiates to the middle or upper back. It often feels worse after eating or when lying down, and better when leaning forward. Why does this happen? As the pancreatic tumor grows, it can press on surrounding organs and nerves, including those that extend to your back. This creates a very specific pattern of pain that many doctors recognize as characteristic of pancreatic issues. My colleague Dr. James experienced this himself. At 83, he initially dismissed his discomfort as muscle strain from gardening. But when he noticed it always worsened after his evening meal, he recognized the pattern. An MRI revealed a small mass on his pancreas, which was successfully removed. If I hadn't been a doctor, he told me later, I would never have connected the dots. If you experience this type of pain for more than 2 weeks, try this simple test at home. Lean forward in your chair. If the pain lessens somewhat, this could be significant. Record when the pain occurs, what makes it better or worse, and take this record to your doctor. Ask specifically, could this pain pattern be related to my pancreas? This question is crucial because it directs your doctor toward considering tests they might not otherwise order. The third symptom to watch for is jaundice, a yellowing of the skin and the whites of the eyes. This is often one of the earliest signs of pancreatic cancer, particularly if the tumor is located in the head of the pancreas, where it can block the bile duct. What most people don't realize is that jaundice often appears in subtle ways before the obvious yellowing of skin. The earliest signs include darkening of urine to a cola or tea color, lightening of stools to a clay color, and itchy skin, particularly on the palms and soles of feet. My patient Elaine, who was 76, noticed the whites of her eyes had a slight yellow tinge while applying her makeup. Her daughters hadn't even noticed it yet. Because she came in immediately, we found a small tumor that was blocking her bile duct. After surgery to remove the tumor and a short course of chemotherapy, Elaine has remained cancer-free for 4 years. Here's what to do. Check the whites of your eyes in natural daylight, not artificial light, which can have a yellow cast. Look at your urine color. It should be pale yellow, not dark. And monitor your stool color. Any lightening should prompt a doctor's visit. If you notice any of these changes, see your doctor within a week and specifically mention jaundice and your concern about your pancreas. The fourth symptom is a change in your stool or new-onset digestive problems. This includes light-colored, greasy stools that float in the toilet bowl, diarrhea, constipation, or steatorrhea. which is essentially fatty, foul-smelling stool that's difficult to flush. These symptoms occur because the pancreas produces enzymes essential for digestion. When cancer blocks these enzymes from reaching your intestines, you can't properly digest fats and other nutrients. This is particularly important if these digestive changes are new and persistent. My friend Bernard, also a doctor, noticed his stools had become unusually light and floated in the toilet. At 85, he'd never experienced digestive problems before. Instead of dismissing it as age-related, he got tested. The pancreatic tumor they found was small enough to be completely removed surgically, and at 90 he's still playing golf every week. If you notice these changes, keep a simple diary for 2 weeks. Note the color, consistency, and any difficulty flushing. Then ask your doctor about pancreatic enzyme tests, simple blood tests that can help determine if your pancreas is functioning properly. The 5th symptom is new-onset diabetes, or sudden changes in blood sugar levels, particularly in people over 70 who have no family history of diabetes and are not overweight. The connection between sudden onset diabetes and pancreatic cancer is still being researched, but we know that pancreatic tumors can affect the organ's ability to produce insulin. In fact, studies show that about 25% of pancreatic cancer patients are diagnosed with diabetes in the year or 2 before their cancer is discovered. My patient Dorothy was 81 and had always had perfect blood sugar readings. When she suddenly developed diabetes, her primary care doctor started her on medication without investigating further. 6 months later, when she developed additional symptoms, we found advanced pancreatic cancer. This is why new diabetes in older adults should never be dismissed as just getting older. If you're over 70 and suddenly develop symptoms of diabetes, increased thirst, frequent urination, fatigue, ask your doctor for comprehensive testing that includes pancreatic imaging, especially if diabetes doesn't run in your family. The 6th and final critical symptom is what I call the feeling of fullness. This is when you feel full after eating very small amounts of food or experience nausea and vomiting, particularly after fatty meals. This happens because the growing tumor can press on your stomach and surrounding organs, reducing the space available for food. It can also affect hormones that regulate appetite and digestion. My patient William, 88, had always enjoyed hearty meals. When he suddenly couldn't finish even half his usual portions, his wife insisted he see me. "It's not like him to leave food on his plate," she said. This change in appetite led us to discover an early-stage tumor that was successfully treated. If you notice you're feeling full quickly, try this. Use a journal to track how much you can comfortably eat at each meal. For 1 week, if you consistently feel full after eating less than half your normal amount, this warrants medical attention. Ask your doctor specifically about an upper endoscopic ultrasound, which can visualize the pancreas better than many other tests. Now, let me tell you about Marion, who was 77 when she came to my office. For months, she'd been experiencing vague abdominal discomfort and had lost about 12 pounds. "My family doctor told me it was just age-related," she said, "but something didn't feel right. When I examined Marion, I noticed a slight yellowing in the whites of her eyes that even she hadn't detected. We ordered immediate testing and found a pancreatic tumor that thankfully was still contained to the pancreas. After surgery and treatment, Marion is now 82 and recently attended her grandson's college graduation. If I hadn't insisted on more testing, she told me, I wouldn't have been here to see him graduate. Every day feels like a gift now." Then there's George, who was 85 when his daughter noticed his skin looked slightly yellow during a video call. George hadn't noticed it himself and felt perfectly fine. But his daughter, remembering a talk like this one, insisted he see his doctor immediately. The doctor found a small tumor at the head of his pancreas. Because it was caught so early, before George had experienced any pain or other symptoms, surgeons were able to remove it completely. 3 years later, at 88, George is still tending his beloved rose garden and recently welcomed his first great-grandchild. "I had no idea," he told me later. "No pain, no discomfort. If my daughter hadn't noticed that slight yellowing, I wouldn't be here today." These stories remind us of something powerful. Knowledge and early action can change the course of this disease, and that's why I'm sharing this information with you today. Here's what I want you to remember above all else. Your age should never be used as an excuse to dismiss troubling symptoms. You've lived long enough to know your body better than anyone. If something feels different or wrong, it probably is. Trust that wisdom. Advocate for yourself. And remember that early detection of pancreatic cancer can make all the difference between a story that ends too soon and one that continues for many beautiful chapters. If you recognize any of the symptoms I've described, unexplained weight, loss, that specific pattern of back and abdominal pain, even slight yellowing of the eyes or skin, changes in stool, new onset diabetes, or feeling full quickly, please don't wait. Make an appointment with your doctor this week. Take notes about your symptoms with you. And don't be afraid to specifically mention pancreatic cancer and request appropriate testing. The tests that can detect pancreatic cancer early aren't complicated. Blood tests, ultrasounds, CT scans, and MRIs are all commonly used. None of these are painful or particularly difficult, even for those of us in our 80s and 90s. And remember, having these symptoms doesn't mean you definitely have cancer. But checking them promptly means that if you do, you'll have the best possible chance at effective treatment. I'm 94 years old now. When I was diagnosed with pancreatic cancer at 91, many might have thought treatment wasn't worth it at my age. But because we caught it early, I've had 3 beautiful years I might otherwise have missed. I've seen 2 new great-grandchildren born. I've celebrated my 70th wedding anniversary. Every morning, I still wake up next to my wife of 70 years, and every day feels like a blessing. It's never too late to fight for your health, to advocate for yourself, to seek answers. Your life has value at every age, and the wisdom you've gained over your many years is a gift this world still needs. So please, if you've recognized any of these symptoms in yourself, make that call today. Do it for yourself. Do it for the people who love you. Do it because your story isn't finished yet. And if you found this information helpful, please share it with someone you care about. Like this video, subscribe to our channel for more life-saving health information for seniors, and leave a comment below if you have questions. Until next time, this is Dr. Harold Silverman, reminding you that knowledge is power, especially when it comes to your health. Take care of yourselves, my friends.